A guide to end-stage renal failure treatments. Hello, my name is Ellen. I am a retired renal nurse. I do hope you find this video helpful. The progression to end-stage renal failure, ESRF, is a crucial moment in a person's life, and treatment is essential to maintain life. Most patients progress from chronic kidney disease, CKD, to end-stage renal failure over time. In this guide, we list some of the symptoms you may be feeling and explore the various ESRF treatment options, including dialysis, kidney transplant, and palliative care. Chronic kidney disease progresses in stages. There is no one way to know how long it will take to progress through the stages. The primary goal of CKD management to help with the symptoms and slow down the progression of the disease with medication, diet and lifestyle changes. However, once you reach stage 5 end-stage renal failure, you must have some form of renal replacement therapy. Stage 1 EGFR 90 or more kidney damage with normal function but with protein in urine percent of function 100 to 80%. Stage 2 EGFR 60 to 89 mild decrease in kidney function percent of function 80 to 60%. Stage 3 EGFR 30 to 59 mild to moderate loss of function percent of function is 59 to 30%. Stage 4 EGFR 15 to 29 severe loss of kidney function 29 to 15% of function. Stage 5 EGFR less than 15 kidney failure percent of function less than 15%. What is end-stage renal failure? End-stage renal failure, ESRF, is a serious condition that occurs when the kidneys can no longer function effectively. The kidneys filter waste and excess fluid from the bloodstream. When they are no longer able to perform this function, dangerous levels of waste and fluid can build up in the body. ESRF is typically the result of chronic kidney disease, CKD, which is a gradual decline in kidney function over time. Some of the most common causes of CKD include diabetes, high blood pressure, and glomerulonephritis, a type of kidney inflammation. The symptoms of ESRD can be severe and can significantly impact a person's quality of life. Some of the most common symptoms of ESRD include fatigue and weakness, swelling in the legs, ankles, and feet, shortness of breath, nausea and vomiting, loss of appetite, confusion and disorientation, seizures, and muscle cramps, itching and dry skin. It's important to note that the symptoms of ESRF can be caused by other medical conditions. It's important to see a doctor if you're experiencing any of these symptoms. Once you reach ESRF, you must have treatment to live. There are several treatment options available for ESRF, including dialysis, kidney transplant, and palliative care. Hemodialysis involves a machine that will remove the waste in your blood and the excess fluid. You are on the machine 3 times a week for 4 to 5 hours. This can be done in outpatient clinics, or you can learn to do it at home. Peritoneal dialysis uses the membrane that lines your internal organs as a filter. You are taught how to do this, and it is done at home. Ask your doctor or renal nurse for more information. Kidney transplantation is a complex procedure, and there are several factors that can impact a person's eligibility for transplant. Their compliance with medication and treatment, age, overall health, and the availability of a suitable kidney donor. Not everyone can have a transplant. A kidney transplant is a surgical procedure in which a healthy kidney is transplanted into a person with ESRF. This is the preferred option of treatment. The patient will have a return of kidney function and no need to be on dialysis. The patient will need to be on anti-rejection medication forever and require monitoring. There are 2 sources for a donor kidney. A live donor, usually a relative, can donate a kidney if they are a compatible match. A deceased donor killed in unusual circumstances, usually an accident, and is brain dead. Only 1% of deaths are suitable for organ donation, and the wait for a kidney can be long. You will need to be on renal replacement therapy until you can have a transplant. Palliative care is when the person decides not to have treatment for their ESRF. If they feel the burden outweighs the benefits and will die from their renal failure, they can be supported in this, and it may involve medications to manage pain, nausea, and other symptoms, as well as psychological and emotional support for the person and their family. We hope this helps you. Ellen and Michael Moriarty, 2 RNs.